We lead while others follow. We lead while others follow. Vicinity FM 95.3. We lead while others follow. Àwa làgbà wọn. We lead while others follow. Aṣíwájú ni wá. Vicinity FM àwa ni bàbá. We lead while others follow. We lead while others follow. Vicinity FM ní kejìlé. We lead while others follow. Àwa lọ̀gá o. We lead while others follow. Adìẹ funfun àwa ṣá ní bàbá gbogbo. Àwa ní bàbá. Vicinity FM 95.3. Ẹranko tí ó ṣe bí olólàájú kò sí nígbó Àjíkẹ́ Adé. Erin lákàtà gbérin àwa gòkè á lọ. Ìyẹ́lẹ̀ ó máa wò lẹ́yìn ẹyẹ wa. Lọ́jọ́kọjọ́ nígbàkúgbà bàbá ni bàbá ń jẹ́. Lọ́jọ́kọjọ́ nígbàkúgbà bàbá ni bàbá ń ṣe. We lead while others follow. We lead while others follow. Vicinity FM ọ̀gálá jẹ́ Adéọlá Noite ló ní ẹ̀ máa gbọ́. Mo fọwọ́ ẹ̀ sọ̀yà. We lead while others follow. Vicinity FM àwa ní bàbá. We lead while others follow. Àwa lọ̀gá àwa làgbà wọn lọ́jọ́kọjọ́. 95.3 Vicinity FM. Tọmọdé tàgbà darúgbó tómi dán ló sọ pa wá ní. We lead while others follow. We lead while others follow. Vicinity FM àwa ní bàbá. Vicinity 95.3 FM Ìkejìlé. Ọ̀tọ̀ nìkan láàrin òkúta ayàtọ̀ sí wọn jọ̀ọ́jọ́.
Music. Sports.
In towards Lukaku.
Entertainment. Politics. All on your darling station, Vicinity 95.3 FM, Ìkejìlé, Ìjẹ̀ṣà.
Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. Running in the sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at night time makes us strong and bright. Health is wealth, let's shout it loud. Being healthy makes us.
Ulcer is what I'll be talking about on the program You and Your Health this week on Vicinity 95.3 FM. My name is Adeshola Salami, your health guide.
Brush your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits, they're the key to living well and feeling free.
Ulcer is a sore that develops on the lining of the esophagus, stomach, or small intestine. What are the symptoms of ulcer? What happens to your body and signs to look out for that will let you know that ulcer is here? First, upper abdominal pain is a common symptom. Pain in the chest or upper abdomen, dull or burning stomach pain, nausea, and vomiting. Other signs can be black or bloody stools, bloody vomit, and weight loss. Others can be burping, bloating, fatigue, and chest pain. And the pain in the that's the dull or burning stomach pain is usually in the upper abdomen, often between the breastbone and navel. This pain may occur when the stomach is empty or at night, and it might be relieved temporarily by eating.
Every day, health is wealth in every way. Running in the sun. sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at night time makes us strong and bright. Health is wealth, let's shout it loud. Being healthy.
You can also have abdominal discomfort, indigestion, nausea. As I mentioned, there is passing excessive amounts of gas or vomiting. For some people, pain may be worse at night or during meals, especially when you take spicy foods.
They're the key to living well and feeling free. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way.
A peptic ulcer, that's a stomach ulcer, can be identified by these symptoms: abdominal pain, feeling full after eating a small amount of food. And for any type of ulcer, it is important you consult a medical doctor for proper diagnosis, as symptoms can vary and may not even be present. Please get to your doctor if you experience sudden, severe abdominal pain, if you vomit blood or have black tarry stools, and if you have symptoms that are persistent or worsening.
Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day.
Ulcer can be categorized into digestive and non-digestive types. Digestive ulcers, like peptic ulcers, are found in the stomach and intestines, while non-digestive ulcers include arterial, venous, mouth, and genital ulcers. Now let's talk about peptic ulcers. Peptic ulcers are further classified as gastric ulcers, and gastric ulcers occur in the stomach and duodenal. That they occur in the duodenum. That's the first part of the small intestine. And the second of the digestive ulcers is esophageal ulcers. These are formed in the lining of the esophagus.
Happy habits, they're the key to living well and feeling free. Well, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. So let's take care of our body and mind.
And the second is the non-digestive ulcers. I said that the ulcer can be categorized into two, digestive and non-digestive types. And the non-digestive ulcers are arterial, venous, mouth, genital, diabetic, foot ulcers, pressure, corneal, and skin ulcers. There are too many. Now let's take these digestive ulcers one by one. Arterial ulcers are open sores that develop due to poor blood flow to the tissue, often found on the lower extremities. Venous ulcers develop due to damaged veins, often in the lower legs. Mouth ulcers, also known as canker sores, are painful, shallow sores inside the mouth. And genital ulcers, usually in the private part, can be caused by sexually transmitted infections, STIs. And still on the digestive ulcers, diabetic foot ulcers occur in people with diabetes and are often caused by nerve damage and poor circulation. Pressure ulcers develop when skin and underlying tissue are damaged due to prolonged pressure. And corneal ulcers are open sores on the cornea of the eye. Skin ulcers, the last on the list, is a broad category including arterial, venous, neuropathic, and other types of skin wounds. This is kind of a combination, and these are all types of ulcers. You are still on to Vicinity 95.3 FM, Ikejile, Ijesha, Osun State. And the program is You and Your Health. And this afternoon, we're looking at ulcer.
Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day.
I've talked about symptoms of ulcer. I actually started by telling what ulcer is all about, and symptoms of ulcer and types of ulcer. Now let's go to the causes of ulcer. What are the causes of ulcer? The primary causes of ulcers, particularly peptic ulcers, are infection and long-term use of non-steroidal anti-inflammatory drugs, NSAIDs. H. pylori, a bacteria that can be found in the stomach lining, can disrupt the protective mucus and increase stomach acid production, leading to ulcer formation. Now we have the NSAIDs, aspirin, and all the rest. They also damage the stomach lining, making it more prone to ulcers.
Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way.
The H. pylori is a common bacteria that lives in the stomach and duodenum. It disrupts the balance of stomach acids and the protective mucus lining, allowing acid to damage the stomach and duodenal tissues. This bacterial infection, H. pylori, is a major cause of peptic ulcer.
Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night.
And the non-steroidal anti-inflammatory drugs are commonly used to reduce pain and inflammation. But the long-term use of or high-dose use increase the risk of ulcers, as they can disrupt the natural mechanisms that protect the stomach lining from acid, leading to inflammation and ulceration.
Wealth in every way. In every way.
Other causes are stress, smoking, alcohol, Zolinga, Elysin, and radiation therapy. And yes, let's talk about these causes I just mentioned now. I mentioned stress, I mentioned smoking, alcohol, Zolinga, Elysin, and radiation therapy. Let's start with stress. Stress is not a direct cause of ulcers, but it can increase the symptoms and worsen the existing ulcers, that is, if you have ulcers. And smoking cigarettes or chewing tobacco, on the other hand, reduces blood flow to the stomach lining, making it more vulnerable to damage and increased risk of ulcers. So also is alcohol, as excessive alcohol consumption can irritate the stomach lining and increase the risk of ulcers. Another cause of ulcer is Zollinger-Ellison syndrome. This is a rare condition where the stomach produces excessive acid leading to ulcer.
Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright, they give us.
Yeah, and the last is radiation therapy. This radiation treatment for cancer can damage the stomach lining, thereby increasing the risk of ulcers.
Running in the sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at night time makes us strong and bright. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. In every way. Brush your teeth, keep them clean.
Now let's go to treatment and how one can diagnose ulcer. And for this edition, I will be talking about diagnosing and treatment of peptic ulcer, because there are too many ulcers, too many. And so we just have to pick on, we have different, maybe another edition we can talk about another type of ulcer. But for this edition, we're picking on peptic ulcer. A lot of people are having this problem. And yes, it's, I don't know, I've just mentioned that the causes and all that, but a lot of people are doing that, having this ailment. So the treatment for peptic ulcer, let me start with the diagnosis. Yes, peptic ulcer is diagnosed through endoscopy, which allows for visualization of ulcers and biopsy if necessary. Yes, this is a kind of a test, but a few people have actually, because those people that have gone through this test, actually come out to say it's kind of painful and all that. But this is a type of test to really know the type of ulcer you're having. Now, the primary diagnostic tool is upper endoscopy, or EGD, which involves inserting a flexi tube with a camera into the esophagus, stomach, and duodenum to visually examine the lining and take biopsies if needed. I think this kind of test is like they insert something into your esophagus, and to actually know if you're having the kind of ulcer you're having. It's inserted into the esophagus, stomach, and duodenum. Like we said that the ulcer that we're talking about, actually into three: esophagus, stomach, and I think the other one is that's talking about peptic ulcer now. That's into three. So and duodenum. So they kind of test where they insert it into this flexible tube with a camera, into these places, esophagus, stomach, and duodenum, to visually examine the lining, and maybe take biopsies if needed. And other tests, depending on the situation, are barium contrast radiography, S3, or upper GI series to visualize abnormalities, fecal occult blood test, check for blood in the stool, urea breath test, or stool antigen test to detect the H. pylori infection, and serological testing for H. pylori antibodies, which is less accurate in confirming cure.
Happy every day, health is wealth in every way. Running in the sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at night time makes us strong and bright. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. In every way. Brush your teeth.
Yeah, the best is for people suffering from ulcer to go for this test. But I can tell you that people just treat, especially in this area. You just treat. As soon as they go to the hospital, and the doctor now confirm that okay you're having ulcer, just start treatments because they feel that maybe the tests are expensive or they are painful or something or out of the reach of the poor. I don't know the reasons, but they just go for the treatment, rather than try to diagnose to see what kind of ulcer they're having. But well, the treatment, for peptic ulcer focuses on reducing stomach acid production, eradicating H. pylori if present, and preventing complications. That's it, because I think the septic ulcer mostly has to do with acid production. So the treatment is just to reduce the stomach acid production. And peptic ulcer, if you are suffering from peptic ulcer, you can be treated with these through medications. Yes, medications. You can have a lifestyle changes and surgery. Yeah, so let's pick on the treatment. Yeah, this is the PPLS, proton pump inhibitors. That's talking about omeprazole and the likes are the primary medication to reduce stomach acid production and promote healing. Sometimes when you are having serious pain and all that, and by the time you get to that, I think it just, help you. And another one is H2 receptor blockers. These are another type of medications for peptic ulcer. It also reduces stomach acid, but they are less effective than the PPLS. So the first thing to do is just to reduce that acid in the stomach. And by the time you're doing that, I think you're getting relief. And also antibiotics can also be used for peptic ulcer. And you're still talking about the treatments now, medications. And yes, antibiotics can be used if H. pylori infection is the cause of the ulcer. That is, if it has been confirmed by maybe the doctor or the test to do that, well, the cause of your ulcer is H. pylori. Yeah, antibiotics can be used under doctor's prescription to treat the infection. And the moment the infection is off, I think you get relief. Another medication is antacids. This can be used to provide short-term relief of symptoms, by neutralizing stomach acid.
For breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy.
I think the thing to do with ulcer patients is that you should know what to eat and not what to eat, what to drink and not what to drink. And that's talking about the lifestyle changes here. A person suffering from ulcer should stay clear of non-steroidal anti-inflammatory drugs, as they can worsen ulcers. And also patient should also stay off smoking and alcoholic consumption, and also avoid spicy foods. You hear that people having ulcer will still be eating spicy food and all that. This is not okay for ulcer patients. Most times they tell them that they are pepperless, because they can't eat anything pepperish. And another way, after the medication, lifestyle changes and all that, is through surgery. Although this is rare and is not actually recommended for younger ones, I think if at all you want to go through surgery, maybe elderly people, but it's always rare. It's rare, and it's only when ulcers are severe or resistant to other treatments, surgery may now be considered to reduce acid production or remove the affected part of the stomach.
All can see a happy, healthy life for you and me.
Yeah, I always said that prevention is better than cure. It is better to prevent ulcer from, dealing with you than managing it, because one, the pain, the money used in buying drugs and all that, the time, spent in going to the hospitals, visiting your doctors and all that, it's not better to prevent ulcer than to manage it. Now, how do you do this? Yes, you mentioned lifestyle changes. Yes, if you're able to, know what you put into your mouth, that can be reduced. Avoid long-term use of NSAIDs. Those are the drug pain relievers. Yes, if you're able to avoid long-term use. Yes, maybe even if you want to use it just once in a while. Then you treat H. pylori, that's bacteria, immediately to prevent future ulcers. Yes, those are the ways to prevent ulcer now. Then you have a lifestyle that will not encourage ulcer to thrive in your body. You avoid smoking, you avoid alcoholic drinks, you avoid eating of spicy foods, and you stay off stress. It's so unfortunate that most people with ulcer, like to eat spicy foods and get into all kinds of stress. These are not good for you. So if you're able to do all this, get off stress, manage, avoid long-term use of NSAIDs, treat H. pylori, and have good lifestyle, then you're good to go. It also will be far away from you if you have not actually gotten it. So till another time, when you and your health program will be coming your way on this radio station, Vicinity 95.3 FM. I am Adeshola Salami, your health guide, saying good afternoon. Have a lovely day.
Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright, they give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth and
We lead while others follow. We lead while